Hi everyone, I'm Namita Jain, a wellness specialist and a wellness author, and I'm delighted to be in conversation today with Dr. Shailesh Raina, a leading Urosurgeon in Mumbai. I'm looking forward to getting insights on pelvic floor health. Doctor, the pelvic floor consists of muscles and tissues and the bowel and the bladder and in women the uterus. But how does one maintain strength? I mean, does exercise help in this process?
Thank you. You know, pelvic floor has
Yeah.
been neglected for so long.
Yes.
And we are fortunate that we have a society known for pelvic floor. We call it the Pelvic Floor Society. And a few of us interested in pelvic floor have realized today that it's not just about the bladder or about, it's all
Yes.
together, all in one.
Yes.
If you have excess of weight and your muscles are lax, then you can lead to problems of pelvic floor, which is organ prolapses.
Yes.
If you have constipation, then you can have a problem with pelvic floor. Incontinence is another problem with pelvic floor. Incontinence doesn't necessarily mean it's all because of the bladder. The pelvic floor has muscles, as you said, tissues, but most
Yes.
importantly, the
Yes.
pelvic floor has fascias.
Yes.
And those arcs and facial arcs,
Yes.
they are what hold the pelvic floor. See, the pelvic floor is this.
Yes.
It's holding three organs there. It's holding the bladder, it's holding the bowel, and most importantly in women, the uterus.
Yes.
So exercises are important. Pelvic
Yes.
floor exercises are a must.
Yes.
People who have lax pelvic floor
Yes.
muscles,
Yes.
they need pelvic floor training.
Yes.
The problem we see today also are that many people who have just urgency frequency,
Yes.
but that's not pelvic flow. They are told to do Kegel exercises. Now,
Yes.
when you have urgency frequency, you are tightening the muscles more,
Yeah.
so your urination becomes less. That is not what should be done.
Okay.
Otherwise, pelvic flow health is something very, very important
So that's a very good takeaway that Kegel should not be done.
in patients of frequency
Yes,
urgency.
yes. The one more question, doctor. When people are doing exercises, they tend to sometimes lift very heavy, more than what their strength can take. Is this recommended or not recommended for pelvic floor health?
You know, for pelvic floor health, you have to relax the pelvic floor. The pelvic floor needs to be relaxed. And when the pelvic floor is relaxed, most of the organs do their functions properly.
Yes.
And if you're lifting heavy weights, you're
Yes.
basically contracting pelvic floor, you're
Yes.
contracting your muscles all over.
Right.
That is a no-no for pelvic floor health.
Thank you, Doctor. I think this is such a wonderful takeaway for so many people who are lifting so heavy, and they should understand that it's not really recommended for pelvic floor health. Thank you, Doctor, for your time. Thank you for this interaction.
Pleasure.
Thank you.
Pleasure.